And we are live. Yay. I'm talking to
Yay.
the very
Awesome.
special Dr. Robert Kiltz. Rob Kiltz right here is what it says. I'm so happy to talk to you because you like to help people make babies. And I suffered most of my life through my menstrual cycles. And I didn't realize eating this way could help. And so I want to talk to you about that.
Well, ultimately, is the most amazing thing I've learned also is that it turns out the healthy food we've been recommended to eat forever turns out to be the cause of all our diseases.
It's crazy. It's really nuts. Um, can you? I know everyone knows who you are, but just in case somebody doesn't, can you do like a little brief introduction of who you are, what you do?
Well, let's see. My name is Dr. Rob Kiltz. Hey, you, Dr. Rob, Dr. Kiltz, Kiltzy, whatever you want to call me. I go by anything. And I'm a fertility specialist. I own and run CNY Fertility Centers with an amazing group of almost 500 staff members around the country and the world, by the way. And I went into medicine in order to help people. And my sister had diabetes since age 4. And so I dealt with that for years. And I decided to go into medicine. And, I initially started off thinking I'd be a family practice doctor. And then I found myself going into internal medicine for a year. And then I switched to OBGYN. Then I switched to fertility. And through the years, I've seen so much suffering and not knowing what the cause was. Well, I suffered. I had bowel bleeding, arthritis, psoriasis, kidney stones, migraines, ADHD, OCD. I grew up in LA, kicked out of school in a gang, couldn't read. That's kind of like my tagline, I think.
Oh
And
wow.
but those are the things. Hardship builds a strong ship, I've always said in life. And I look back at all of it and think, wow, God was really working me out to build me up. And that's the part I love. But I went into fertility medicine, and over the years, I integrated Eastern and Western medicine together: yoga, acupuncture, massage, meditation, and prayer. And then about 20 years ago, I had some of my patients getting pregnant on paleo diet, and I'm like, "What's paleo diet?" I didn't know anything about it. I'm an Italian, Mediterranean. I love all sorts of vegetables and fruits and fiber and seeds and nuts and lean meat. And so I dug into paleo, and then I tripped over Maria Emmerich and found keto and more. I was Atkins before that, and then I found carnivore, and I'm like, whoa, what is this? And I went carnivore at age 55. I'll be 68 in March. I've never felt better. I occasionally touch a plant, but not that much. And I share keto and carnivore with my patients. I blog about it, write about it. But I also talk about Eastern and Western medicine tremendously. And I always say faith is first, and eat the meat, be the master, and to get up and go do something every day. So here I am.
That's awesome. Thank you. um, so we touched upon this last time we spoke, and that was on September 16th, where I survived. I don't know. No, I think I had endometriosis, and I didn't even know what that was until I was like talking about an experience after eating carnivore of how I didn't even have a cramp like 3 weeks into carnivore. I will say having kids changed that tremendously, but can you explain a little bit what endometriosis is and how that could be caused and self-generated without even knowing?
Well, think of endometriosis, endometritis. The osises and the itises are some inflammatory condition, diverticulitis, diverticulosis, right? And just pick an organ system and give it a name. The itis typically means it's an inflamed condition. We think it's either bacteria, yeast, or viruses, but it could be something else. And the osis means you got something wrong, but we don't know the cause. And endometriosis is just another one of those, in my opinion, plant-based, low animal fat, lean meat, diet diseases. And the gut is the single leading place for all of this inflammation to take place. But then once you damage the gut, all the damage happens systemically. And the bowels sit right next to the ovaries, tubes, uterus, and they're in the pelvis. And so to me, an inflamed bowel causes damage to the peritoneal surfaces in and around the ovaries, tubes, and uterus. which we call endometriosis, which causes no symptoms, or it
Mhm.
can cause infertility, miscarriage, pain, cramps, you name it. It can cause all sorts of problems and damage to the point where a woman needs either her ovaries, tubes, or uterus removed in order to reduce the symptoms that they suffer from. But in many cases, even if you remove the pelvic organs for a woman, the pain persists and endometriosis may even persist. So it really, to me, I'm beginning more and more to realize it's an inflammatory condition, which I believe starts in the gut.
Mhm.
And then it damages the peritoneal surface that are critical for a woman. And again, the ovary, tubes, and uterus can be damaged so much that a woman becomes infertile, or they lost their ovarian function and become menopausal early.
Oh,
It's
wow.
such a debilitating and such a common disease. And many women don't even know they have it.
Right.
They call it silent endometriosis. And so many women that are infertile or repetitive miscarriages have no pain or discomfort with intercourse, and they're like, well, I don't have, or abnormal ultrasound, so I must have endometriosis. But I would say that infertility and miscarriages are all screaming pain and sorrow and
Right.
emotional distress, that it's
Sure.
not silent. But I think the endometriosis, and typically for endo, so we had a woman today, we did a laparoscopy on, we find little areas of scar tissue. Sometimes the ovaries attached to something it's not supposed to be attached to. The tubes are damaged, or there's the little areas, we call them powder burn, blue areas or black areas in around the tubes, ovaries, and uterus, that you can either excise them or vaporize them to remove them, which may help reduce some of the symptoms and signs of endometriosis, and may help people that conceive and deliver a baby naturally or improve their odds with IVF or other fertility treatments. And so it doesn't always require a surgical procedure to find it. There are some endometrial biopsy techniques that you can do to identify it, but quite often it goes undiagnosed for years in so many women, where it's kind of tossed off of, here's a pill, a birth control pill or a
Mhm.
pain pill, and use a heating pad and suck it up. But I think that we just need to think, what is the cause of all this disease? That's
Right.
the thing that I've dug into more and more.
Okay. Yeah, exactly. So why would it be like in my case, for instance, like, so I'm eating a bunch of steak all of a sudden, fatty meats, butter, eggs, and 3 weeks later, my period is actually early. This is like when I first started. My period's actually early, and I'm like, wait, why don't I have? There's nothing. Is this what's normal? 25 years of pain, and this is what's supposed to happen?
Well, this is the magic of carnivore.
Yeah.
And you could get better on keto, but carnivore is like the game changer. And again, plants want to kill us. My good friend Anthony Chafee loves to say, and ultimately plants are the predators, and we are the prey. And the why part of it is simple. Number one, plants, I don't care what plant you are almost only sugar. And
Okay.
sugar glycates. Glycation is rust. And basically, it damages your gut, then it contributes to leaky gut. And then the sugar layer levels in systemically are higher, which causes more damage to the body. And the thing called the glycocalyx or the glycobiome, there's sugars in our body, but when you add plant sugars, you damage them even more. You damage the proteins, you damage the fatty acid layer that protects your cells, you damage the immune system. And so now you've got a hyperactive immune system, which is causing, it's like pouring acid all over your belly, inside your gut, and causing more damage. So, carnivore and fatty meat, because if you do protein, see, protein converts to sugar, which also glycates. So you have to be careful about a high protein diet, which most people don't really understand that very much, but it's really the kick-ass, most amazing thing, because all you need to do is remove the plant poisons, Now your body can heal and do it naturally. Again, even as a vegan, vegetarian, and Mediterranean, like fasting. Oh my God. I'm on day 2 of 5-day fast right now. And I drink water. I drink mineral water and no food. Empty the gut, allow the gut to heal, reduce the poisons in the body, now allow the autophagy, which is basically the body cleaning up and repairing dead, dying, and damaged cells. And by doing that, endometriosis goes away. And that's the magic to this. But why some people have it and other people don't, it's a mystery. No one knows that. There's a genetic predisposition, but ultimately we're all meant to be land animals and breathe air. We're not water animals or flying animals. That's not who humans are. And my bet is we came out of the trees to eat the grass eaters, not the grass. And ultimately we've been lied to over the last 10,000 years, and it's getting even worse over the last 100 years, that we're convinced that we should be eating plants and not animals.
Yeah, makes sense. Makes sense. Mike has a question.
Hey, Mike.
Hi, Mike. I'm not a woman. That's true. But what is your opinion on women getting relief when they take in some carbohydrates during or close to their period? Could similar effect be achieved by increasing protein intake? What do you think about that? Well, I love your plant, by the way.
Oh, this is my little plastic plant. It's my friend. It's plastic. I'm not allowed to have real plants near me. But ultimately, look, I love plants. Plants, without plants, we wouldn't be here. We know they're required and necessary in the universe. It's just to minimize their consumption. But think about drugs that they're on my lives every morning. Someone's saying people should use mushrooms. Microdosing with mushrooms. All right. That's a drug. And so remember, plants make drugs to make you feel good. So why do we feel good? Because drugs come from plants. Heroin, cocaine, marijuana, nicotine, caffeine, opium makes you feel good. I mean, basically Coca-Cola, we used to be, had cocaine in it, chewing tobacco and all these drugs that come from plants. People are readily using them because it makes them feel good. Now, people think, oh, I'm cured. You're not cured. Your brain says, oh, okay, no pain for right now. We're gonna soothe you and make you feel better. Why do you think the epidemic of drugs in the world, in America, is crazy? And the doctors are the biggest pushers of the drugs. And again, I was trained to do that. I went into medicine to be a doctor and learned the modern medical way. And basically, I wrote prescriptions for drugs time and time and time again. And I've learned over the years that, people eat plants, it makes you feel good. That's normal. It's supposed to, because it's also supposed to make you want to eat more of that.
Right.
The sinister plants want to make you fertilizer faster than you know. And by the way, women, so colitis, Crohn's, IBS is on the rise. Colon cancer is on the rise. Endometriosis, endometritis is on the rise. Infertility is on the rise. PMS, PCOS, interstitial cystitis. All these things are sort of diet and pelvic damage related to a deadly damaged colon more than anything. And so men get many of these things also, by the way. So to think that men are without the signs and symptoms of endometriosis, they don't get the typical same thing, but no one's really looking at men in the same way. It's colitis, Crohn's, IBS. I bet if we looked at women and looked more at bowel issues, we would solve a lot more of the endometriosis, fibroids, adenomyosis issues. Sure. In my opinion.
Okay. Yeah. That was one of the things that handled instantly was like years of bowel issues, diarrhea and all that stuff. And I thought it was healthy to eat like just buckets and buckets of plants, and I couldn't stick to it. And what I mean, like salads, and I couldn't stick to it. And so then I would just go back onto my cheesecakes.
Well, I loved salads. I love popcorn. I love Doritos. I love salsa. I love Coca-Cola. I could do a 6-pack of Coke a day, and I was a skinny, scrawny kid, and that never gained weight until I finally did gain weight, like
Right.
all of us eventually do. But
Right.
it never, ADHD, depression, anxiety, bowel problems, migraines as a child. And I went to the GI doctor. No one could figure it out. Maybe I have appendicitis. I was convinced I had appendicitis or something. And they're like, we don't know. And so I took Pepto-Bismol, Rolaids, I don't know, Malox and Excedrin and caffeine as a young child. And
Oh, wow.
so it took me 55 years to go like, whoa, this is crazy amazing. It's as simple as we're doing the improper human diet, and we're recommended by the medical profession, the nutritional experts, and the government, which basically all they want to do is sell more grain.
Right.
And now the government's, they're pushing marijuana on kids, alcohol, all these things. And again, ayahuasca, psilocybin, mushrooms. It's going to mess up your brain. Why would you do that? And
Right.
we so many of us have tried these things from time to time in times past. But I will tell you that now I understand the cause of disease is simply, they want to make us weak and meek.
Sure. Yeah, exactly.
Control.
I was never into the marijuana smoking, but I was a big cigarette smoker for 17 years until I saw that I was pregnant. And then I stopped. Cold turkey.
And interesting enough, not that cigarettes are good for us, but 90% of people that smoke cigarettes don't get lung cancer.
Oh, it's very funny.
and so, when we talk about, tobacco is worse, well, maybe the vegetables, the fruit, fiber, seeds, and nuts, and the processed foods, which are made of plants, are really the cause of disease, including lung cancer.
Oh, interesting. Yeah. No, I quit because I just, I don't think you're supposed to smoke when you're pregnant, right?
Right. I mean, you finally realize, okay, I've got a child in there. And the important point, and I'm going to plug this.
Yeah.
I'm just coming out. We're working on our new Babies for Babies diet book. And I don't use diet book. It's the proper human nutritional solution, but it's basically what should you eat when you're working to get pregnant? And then when you're pregnant, what should you eat? And when you're breastfeeding, what should you eat? So think about it, that women are eating a typically plant-based low animal fat diet.
Mm-hmm.
That means the sugars and the toxins from the plants are crossing the placental membrane and they're addicting that child in utero.
Interesting.
That's all it is.
Yeah.
And so if we can go on the campaign to help people that are eating a plant-based low animal fat diet and eating 3 to 6 meals a day and that are suffering, and if they're not, they're going to in the future, and their children are going to suffer wherever they're at. And I know, again, I suffered because of my mom's diet, and then the diet we ate as young children. I don't blame anyone. I'm not here to point fingers and blame anyone, because ultimately only one person's responsible for what I put in my body, and that's me.
Right.
And if we can continue to share this story in a massive way, and again, you can take all of my information and use it on all of your posts. I encourage that. The idea here that we need to be inspiring everyone to become the lions and stop being the pigs, cows, and sheep.
Right. We need to eat those.
Yeah, that's it. My food. This is my food's food, as they say.
Yeah.
And again, it seems so wrong. And I talk about it. I don't care who you are, what your problem is. I'm going to at one point get to you about keto or carnivore and faith and fasting. I'm going to touch on any of those things in the process of a consultation or a follow-up with me. I had one gal. She had a baby from IVF. She's already had a colectomy, and she then had a miscarriage with another transfer, and then she got pregnant spontaneously, despite the fact that she probably has a ton of scar tissue in her belly.
Oh,
so
wow.
Life is going to push its way and try to find a way to make a baby, even the doctor says, "Oh, you'll never get pregnant naturally." Wrong.
Wow.
And so once I got through the standard talk, it's like, okay, what are you eating? And most people say healthy. Some people say junk, but it's cereal, it's grains, it's lean meat, and just change one simple thing: eat the meat, be the mommy; eat the meat, be the man; eat the meat, be the master. And if we really learn to put that out there, it changes so many lives, and we all need that change.
Right. 100%. My kids are so funny. Sometimes they like, I made ribs this morning, and like just fatty ribs for breakfast. And they ate like a couple bites and they were done. And then I made pork chops for lunch. They ate a couple bites, they're done. Sometimes my son, one day he didn't eat all day. He's 7. And then he was like, Mom, I want some cheese. I'm like, okay.
Well, and I do a little bit cheese.
Yeah.
But I think cheese, milk products, and eggs have a little bit of antigenic capability. So people have to, find their right set point on that, and be careful consuming that. But I think for kids, if they see the grass and grains, the plants set the seed for the inflammation that I think affects us even when we eat the milk products or the eggs. But also important is those cows and those chickens that are eating the soy and the excessive plant-based, when they're probably, for the chickens anyway, they're carnivores. They're an omnivore. They can eat that other stuff, but pasture raised, free range, and not the government definition of what those things are. The real definition. Look at White Oak Pastures for one. They're really doing it. Some others are also. I think that's really important. But once children, there was another one where the child is they're suffering. They're suffering from asthma or ADHD or depression.
It's crazy.
It's the diet, dummy.
Right.
It's just the diet. Doctors, and my job in life is inspire and awaken the doctors too.
Great. I love that. Now my kids aren't perfect. We're trying to get them more and more perfect, but they eat so much better than I did. I was 10 years old, 4 foot something, 100 pounds. Favorite foods in Chicago. I'm from Chicago. Pizza, hot dogs, French fries. They're doing so much better than me.
Well, it is crazy what we're learning, and so much. You see, I think you can be a ketovore, an omnivore. You can do it.
Yeah.
Find very narrow things you can eat that in general are not going to upset your immunologic status, your inflammation.
Right.
For me, I do some French fries from time to time. Although I just recently watched Marie Emmerich's stuff on she makes her puffy bread out of egg whites and stuff, and then slices them up and make a French fry in tallow. I might try that one. But to me, protein and amino acids and sugars metabolize almost identically. And so the real trick is eat those things infrequently. And if you are, add the fat. And I do duck grease mayonnaise or lard or butter mayonnaise like Maria likes to make. And I think those are really good things.
Okay, awesome. We have another question
for
you. 7 months carnivore with PCOS, period returned around 3 months, but abruptly stopped in December with negative pregnancy test. What labs do you recommend having checked? Thoughts on, I don't know this word, prometrium to jumpstart periods again. Is prometrium a drug?
Yeah, prometrium. Let me see here.
Okay.
7 months carnivore with PCOS, period return after 3 months, but abruptly stopped in December. Negative pregnancy test. What labs do you recommend having checked? Thoughts on prometrium? Well, did you check a pregnancy test?
She says negative with negative pregnancy test in December.
Oh, yeah. Well, you check it again anyway. Sometimes you have to get a serum test because a home pregnancy might not be enough. But you don't need to jumpstart your period. Sometimes you just need to kind of take a look and see where you're at. But stay carnivore, number one. Be patient. Look at acupuncture, cold water therapy, red light therapy. Get out in the sunlight. and fasting can help a lot. But sometimes you need an ultrasound. I mean, I still do traditional fertility medicine. I still think traditional fertility medicine is important because sometimes the damage and disease is enough that you need some extra help. But you could do some prometrium or some Provera to cause a period. But then the question is, how are you then stimulating ovulation? And you might need some letrozole or Clomid, a trigger shot. And we're really working to bring it home that people can do most of this stuff at home. They don't need to go out and see their doctor. We're even working to get ultrasound, vaginal scans, and probes that women can buy or rent
Oh,
and
wow.
get at home and do something new and different. But yeah, we want to bring it at home for sure. But yeah, the prometrium may kickstart the period. Are you doing some people do they're watching their basal body temperatures, their ovulation predictor kits are can be helpful. But I think carnivore and get an ultrasound and maybe look at LH, FSH, estradiol, and a progesterone level. You might get a little bit of information there.
Okay, great. You said in your interview with Grant Cardone that fat isn't like the problem. Being fat isn't the problem. But I'm curious, what's the difference? Like, okay, I started this at 209 pounds, almost 210 pounds. I was obese. I got my weight down between 25 and 30 pounds. I look a lot better. I feel a lot healthier, but it's all in the butt. The rest of that is in the butt. But my point is, like, when is it unhealthy and when is it healthy to have this extra fat on your body?
If the fat on your body is preventing you from participating in a normal life, that's when it's bad.
Okay.
Because if there's a famine and war and pestilence and disease and you can't eat for 6 months, would you either be 250 pounds or 100 pounds?
Right.
We know the answer. You see, why do we all get fat so simply? Because we're meant to. Fat is what we're supposed to be. Skinny is deadly. And we're convincing everyone they should be skinny, and that's wrong. But it's sort of like you don't know what to think anymore because, everyone that's obese is chastised for being obese and you're weak and you just don't know how to do it. But in fact, it's not true. So plus in general, men don't want skinny, and fat is fertile and fit. And that's where we really should be. Sorry.
Okay.
And again, and look at food and sex is really the drive of life because we want, those are the things that make us feel good and happy because that's the thing that nature realizes that's going to make babies. Right?
It's a very good point.
And so our real problem is access. We have too much access to too many calories. Okay. Now what's a calorie? I don't know. But basically, the work I do, I see so many people that are getting gastric bypass surgery. They're now on these new drugs. I mean, I played around with Atkins and Weight Watchers and, the day. I've got, so many people put so much time and money and energy into being skinny, and all they do is get fatter. But the real answer is that the reason is because everything we tell people to do is wrong. But obesity, now, what's the definition? I mean, if you're practicing a normal life and you're feeling fine, well, why do you need to be skinny? You don't. But if you're overweight, it's likely because you're eating a plant-based, low animal fat diet. A Mediterranean diet is a low animal fat diet. I'm sorry.
Mm-hmm.
You eat a lot of plant oils, but you mostly eat plants and lean meat, which all turns into sugar. In the liver, sugars and amino acids via insulin are converted to fat. So you can survive likely the famine, the starvation, the war, the pestilence disease that you and I have been experiencing for the last 3.5 million years.
Right. Okay.
It's really simple. So plenty of obese women get pregnant and have babies. Plenty of thin women don't. I don't tell any woman to lose weight. What I tell them is, wouldn't you like to reduce inflammation that maybe you can have sex with your partner and get pregnant naturally or improve your odds with either IUI or IVF? The answer is yes. And the question is, what would you do to have a baby? The usual answer is anything. Okay. Would you eat meat even though you've been a vegan, vegetarian forever? And I get many yeses. Absolutely. I do that.
Interesting. I'm curious about that then. So when I got pregnant, both times, it was like within a month of trying, and it was like I was so worried it was going to take forever. I love hamburgers, and it's like probably the main food I've ever eaten my entire life until I started carnivore. Do you think the hamburger meat was probably why?
Oh, I mean, ultimately, the fatty meat and hamburger is one of the best, I think, and it's easiest. I mean, all meat's easy to digest, but it's and one other thing about being pregnant, for so many women in early pregnancy, they have nausea and vomiting. They can't eat, food aversion.
Right.
The human body says, don't put the toxins into this body. You're going to kill this baby. So this is why crackers and all this stuff of doctors saying, well, eat this, you'll be fine. Wrong. Don't eat. Fast. Fast and eat Kiltz's ice cream. You might like that one.
I've had it before. It's very good. So my first pregnancy, I was like so hungry all the time. I gained so much weight, 80 pounds, super fast. All I wanted was like hamburgers and French fries and mango and a few other things. And then my second pregnancy, food aversion almost the entire time. I think I lost 40 pounds in that pregnancy because of how much I couldn't eat. Baby came out perfect.
well, so think of it. What access did you have to a lot of food 50,000 years ago?
Not much.
You didn't.
No.
And so our drive for eating is natural, but the problem is we have unnatural food and abundance, which is not good for us, by the way. And this is really crazy stuff. What is the actual building blocks for your baby that you carry on your body?
The fat, probably.
Only the fat.
Only the fat.
Only the fat.
Oh, wow.
Because in the fat is every amino acid, every simple sugar, every mineral, vitamin, fatty acid your body needs. So if you look at bears that hibernate, they lose fat only while they're hibernating and gestating, deliver a baby. They lose no muscle mass and no bone mass. So the answer is really quite simple here. Fat is the most fantastic thing on your body. Wow. It contains all the minerals and vitamins. I personally don't believe that we have muscle wasting while we fast unless you already have no fat and you're just laying in bed for 6 months and not moving. See, atrophy happens from non-motion. And for many women, or for many men and women, when they lose what they think is muscle mass, they're losing intramuscular fat, not the actual muscle itself.
Interesting.
See, there's intramuscular fat, intraosseous fat, there's interstitial fat, there is subcutaneous fat, right? And think of the fat, right? That's in the momentum in your intra-abdominal fat, right? And so you only burn fat as the mitochondrial fuel. Glucose is not the energy for your body. Glucose is for glycosylation. That's what it's for. Glycosylation. So almost, basically all proteins are post-translationally modified. What that means is after a protein is made in the endoplasmic reticulum via the ribosomes and transfer RNA, basically they have to have the right charge, the right shape, the right pH, and the right ability to either dissolve and not dissolve in water, right? Hydrophilic or hydrophobic. Glycosylation is the addition of a sugar, glucose, galactose, mannose, fucose, N-acetylglucosamine, N-acetylgalactosamine, glucuronic acid, uramic acid, sialic acid. There are about 12 to 13 sugars. Glucose is only one of them. And so no one's talking about glycosylation. Glycosylation is the opposite of glycation. Glycosylation is the normal binding of a sugar to an amino acid, protein, or fatty acid to give its function. And glycation is what we see when we have diabetics who have damage to their blood vessels, their kidneys, their brain, their eyes. And think about hemoglobin A1C. Hemoglobin A1C is simply a glycated hemoglobin. That's called rust. And so the idea, why would you ever burn sugar when you have fat everywhere?
Right.
What's the preference and reason to ever burn sugar? And that's where the keto idea is wrong.
Okay.
Completely wrong. And
Okay.
acetyl-CoA is the precursor for the Krebs cycle, that it zips into the Krebs cycle and ultimately makes CO2, H2O, and ATP. And so adenosine triphosphate, which is the energy of your body. It basically gives a phosphate over to the molecular processes of metabolism in order to move my arm, to speak, to talk, to listen, to all the sense for it to be alive.
Okay.
No ATP, no life.
Right.
No fat. If you have no fat on your body or in your body, you will die rapidly.
Oh, wow.
Fast.
Oh, wow. Interesting. There you go. Well, that answers my question.
What was the question?
Should I lose some more weight?
What's that?
If I should lose some more weight.
Yeah. Well, again, it's all about beauty, right?
Right.
And it's all about who should we look like? Be you, love you. And, basically being skinny is hard.
Sure.
It's very hard.
It's true. Every time I've gotten skinny, I'm like, woohoo, I'm 120, 30 pounds. It's gone in like 2 weeks. I've put 20 pounds back on.
I'm 160 pounds. And my sweet spot that I think is 150. Okay. 5'6". But I feel great at 160, but I'm a little egotistical and it's like, oh God, I got to lose a couple weights because I got to look like Chafee or Keto Savage. What's that?
You got to look like Rob Kiltz.
Yeah, well, I know, but we see, that's what this does to us, all of it. Right. Come on. We're all human beings. But I would tell you that it's easy to gain weight. It's hard to lose weight. And why is that?
Because your body wants it.
Because it's meant to be that way.
Okay.
Again, be skinny. Is that good? Again, if there's a famine or disease, you got to have some weight. And fat is the only fuel for the body. Bodybuilders, I know Keto Savage and others really work hard to get that to skinny it down so their muscle definitions show.
Yeah.
But that's only for the show.
Okay.
And the body says, okay, time to get back. Put the fat back there.
Okay. Yeah, there you go. I want to pop up Mike's comment and says, we should not aim to be skinny because of times of famine. We need body fat as a form of energy. There you go.
As the only form of energy.
It's the only form of energy.
It is the only form of energy. And then anyone that tells me, well, you burn sugar and then you burn fat, I just never made sense to me. And my sister died of diabetes. My best friend, Dave Kilmer, died of cancer at 52, both of them. It made me question. And most people have never heard of hepatogenous diabetes.
No.
Hepatogenous diabetes is basically, type 2 diabetes. I call type 2 diabetes liver damage. Type 1 diabetes is pancreatic damage. And so it's simple. As your glucose, as all of us basically eating a plant-based diet, basically from the day we're born to the day we die. Mm-hmm. And our gut is always full of a plant-based diet. So that means plants are constantly digesting and breaking down and sending sugar to the liver. Sugar in the liver requires insulin to say, hey, let's make fat. But eventually the constant exposure of sugars and other plant toxins and protein amino acids in the liver causes the liver function to drop. That means it's not converting the sugars to fat fast enough. Glucose levels rise. Okay, insulin levels rise. Mm-hmm. Eventually, there's so much damage to the liver, it causes fatty liver. Remember, the liver makes fat. You deposit fat in the liver first because that's where it's supposed to be. And then eventually the liver function drops enough that you develop cirrhosis or liver failure. And all of those patients are skinny. They have high glucose and high insulin levels. Now, wait a minute. I thought insulin puts glucose into the cells of your body.
Right.
Nope, does not. And again, this is completely off what we mostly say, but it's radical.
Yeah. Yeah, exactly. Okay, so I'm going to ask a question, but kids need carbohydrates, right?
Just like doctors used to say, cigarette smoking is good for you. And of course we know that's not true. No human animal needs a plant in their diet.
Okay.
All you need fatty acids and you need amino acids. And both those things are provided in an animal-based diet in the right amounts. You don't have to measure macros to me. And the rarer or rawer the meat, likely the healthier for you. But again, Popeye, right? Spinach.
Right.
Or Captain Crunch and all the cartoons, we just sat there. And just like, and ultimately we're lied to. We're lied to by the lions that want to keep us weak and meek and keep us pigs, cows, and sheep.
Sure.
And if you look at Gary and Belinda Fettke's work, if you look at Nina Teicholz's work, but if you go down, you go back and back and back. And listen, read James Henry Salisbury's work on Salisbury steak. He was a doctor, and in the Civil War realized his men were all dying of dysentery and pneumonia. And ultimately, he figured out that a plant-based diet allowed the microbes, the what they call the healthy microbiome, which they're not, by the way, allowed the microbes in your gut to flourish and damage the glycocalyx of your bowels, and then they went everywhere. And when you have systemic infection, you become weak, you become malnourished and listless, and then basically you're soon to death. But he figured out, if I feed you guys meat, I think he fed them meat, coffee, and water, and they all healed. But he did the scientific work. He journaled his work. He wrote a book about it. He shared it. And again, it's a game changer when you realize this. That's why I love the work you guys are doing. It's sharing the simplicity of this story. And that's why, I hear so many people talk about the LDL, HDL, cholesterol, ApoB, and all this stuff. And I'm like, and then the complexities of the different pathways. I'm just a simple guy. I'm a simple doctor. And if I can't understand it, how do we expect just regular non-scientific folks to? By the way, everyone is capable of learning this stuff without going to medical school, without going to university. You get online. The new super way to learn is online and social media and social medicine. That's what I think is the very best way.
That's awesome. That's how I found out about it. It was like Ken Berry. It was Eric Berg, then Ken Berry, and then Anthony Chafee, Rob Kiltz, et cetera, et cetera. But it was Ken Berry was the guy that convinced me.
Well, Ken Berry is a master. I love what he and Nisha are doing. I've been communicating with Ken for a long time, and learning from him. We learn from each other. That's the beauty of all of this. And the more we kick some ass on changing it up. And listen, my doctor is a good friend. I went to the doctor recently. I had a stress echo, because a friend of mine gave me a Christmas present for a coronary artery calcium score, and it was 682. And like, oh my God, like I'm the carnivore. I'm healthy, but I got a high CAC score. All right. So I talked to Phil Avadia. We're going to do a live with that coming up. I'm really excited about that. I got a few more tests to finish up before we have our sit down, and I'm fine. The guy says, I did the same test 10 years ago because a friend of mine dropped dead of heart disease, and everyone's worried, Kiltz, your dad had heart disease and you're going to get it. I did it. I was fine. I did it again. I'm fine. And so, but I go to my doc and I listen and I want to learn more because a lot of docs are open to all these things and they want to learn also. So this is not, I'm not here to say anything's wrong with modern medicine or the doctors. We're just learning on our own.
Right.
You're in charge of your health and wellness, not your doctor.
Okay. Yeah, perfect. Exactly. Ashley has a question. What markers are good to check the function of the liver?
So that's a good one. ALT, AST, look at your even your bilirubin levels. These are all going to be good levels to check. An ultrasound of your liver probably is a good one to check it out. But a metabolic testing, and I think insulin levels and fasting glucose levels are really measures of your liver function. So if you have a high insulin or high glucose levels or hemoglobin A1C, I bet it's your liver that's the problem. Again, type 2 diabetics, everyone's like, well, I have a metabolic disorder. No, you have a liver disorder. But it's really sinister in how you figure it out. But my bet is type 2 diabetes, pre-diabetes is all liver damage, and that's as simple as that.
There you go. That makes sense. Totally makes sense.
Again, think about the anatomy. All of the blood flow from the GI tract goes to the liver. All of the blood flow from the pancreas goes to the liver. Why would that be? Why would all the blood flow from the gastrointestinal tract go to the liver? Because the liver has a very important function. It's not to detox, it's to make fat. And the other part of that story is that when you eat food, when you eat animal products or plant products, they break down to amino acids, simple sugars, and fatty acids. So now the fat goes to the lymphatics. It doesn't go to the liver. It bypasses the liver because it doesn't need the liver. When you eat amino acids and simple sugars, again, plants and animals break down to those three things. The amino acids and the sugars go through the hepatic portal system right to the liver. And when that happens, when the sugar and the amino acids are noted in the GI tract, the pancreas sends insulin to the liver. Why would it do that? In order to convert the amino acids and simple sugars to fat. Now, again, it's not saying, oh, let me lower your sugar level. It's not trying to lower your sugar level. It's trying to make fat. Because if you do not make fat, you're dead. Because if you think about it, no one's eating fat. No one's eating fat. And when I say fat, I talk about animal fat. Plant oils are not the same, in my opinion. You never consume them of any significance or frequency unless it's from an industrial plant. But basically, this is such an important part to understand that the liver's function is to make fat. And since our diets, my diet was a Mediterranean diet has no fat in it. It just doesn't.
Right. Yeah, exactly. And when I would try Atkins earlier, I think Atkins or keto, I was like chicken based.
Well, and I look at, again, a protein sparing modified fast that Maria and Craig Emmerich work with on many clients, I think is great for weight loss. But and they'll still say that it's that weight loss, but you need to add the fat because when you eat fat, it suppresses inflammation in the gut.
Right.
So if you feed a cow a high fat diet, they die. The reason they die is because the microbes in the rumen are killed. They require the microbes in the rumen to break down the fiber and break the cud down in order to get the sugars into their bloodstream along with amino acids to go to the liver via insulin to make the fat. Because cows don't eat fat, do they?
No.
But they get fat on grass and grains. The reason they do is a functional liver. And remember, as the liver damages, you get skinnier, you get cachectic, sarcopenic. And so everyone talks about muscle wasting. I think muscle wasting is a later stage of these diseases, not an early stage.
Interesting. Okay, thank you. I want to let you know we are at 49 minutes. I don't know how much more time you have, but we have at least 3 more questions.
I'm here. I don't, let me see. Where do I have to go? Nowhere yet.
Nowhere yet. Okay, good.
And I'm fasting, so I'm going to go home to my pottery studio. I will look in the refrigerator and look at my dry aged steaks and look at the bone broth that I made and just keeping an eye on it, make sure no one stole it. But I'm here to. This is the best thing to do in the universe.
Okay, perfect. Thank you. So, Ellie, what is the best way to feed children? Carnivore, keto, animal-based, a bit of it all. Sometimes the kids get food outside those diets, but I don't. But I know it's not okay. I know it's not every day. Is that okay?
Yeah, I'd say your children are carnivores. Human beings are truly carnivores. We're apex predators. We came out of the trees to eat the grass, eaters, not the grass. That's the most amazing stuff that I've learned in life. But don't pressure your kids. They're going to eat some stuff from time to time. That's not the killer from us. If they have some cookie cake or ice cream, or they have a hamburger at McDonald's and fries, I don't care. I don't think that's our killer. It's all the time. If most of the time they're eating an animal based and they're really being clean and good, they're likely going to develop the habits. They're going to say, hey, no, thanks. I don't need that.
Right.
And so, at home, do you want to be sort of giving them all these fake foods? No. And look at, again, I always come back to Marie Emmerich's, because for those treat times, she makes some carnivore treats. And there are many other people doing that out there. So, find something. But, to me, I do a treat. I do Kiltz's ice cream. I occasionally do my Kiltz's French fries, fried in tallow, lard, duck grease, dipped in mayonnaise. And I take the grease from the steak, the ribeye, the roast, and I pour it right back over those fries, because simple sugars and amino acids are metabolized almost identically. That's not your problem. And it's all the time being exposed to the plant toxins, not sometimes, unless you happen to have an anaphylactic reaction to a plant antigen. Peanuts. My daughter would die to a banana and avocado. There are many people that are allergic to the antigens of the plants. And so all these sicknesses, ear infections, throat infections, chronic tonsillitis, chronic pharyngitis, chronic skin disorders, all of these diseases are all secondary to a plant-based low animal fat diet. Get rid of the plants, focus on, to me, it's bacon, eggs, butter, beef, and salt. Some people can't tolerate eggs, and some people can't tolerate the cream or the cheeses. So if your child has gone to the lion's diet, or the lion's way, I like to call it, steak, salt, and water, and they're not getting better, if they're doing sort of a standard carnivore, but they're not getting better, then you might look towards a really challenged look at the meat, salt, and water. Some people can't tolerate the beef. Some people can't tolerate the lamb or the goat or the pork. You got to find the thing that works best for you.
Great. Ashley, what is considered high A1C and fasting glucose?
Well, that's one that I don't know that I could tell you the right answer, but over 5.7, over 6 on the hemoglobin A1C. Now, what is fasting? That's one of the most important parts to understand first. I ate my dinner. I ate my 3 meals a day, and I didn't eat breakfast. I went to the doctor. I did a fasting glucose and a hemoglobin A1C. But in fact, your bowel is still full of food. You're still sending amino acids and sugars to the liver. So you're still glycating and damaging hemoglobin A1C, and your insulin and glucoses are elevated. I say a 3-day fasting is what you really want to do to get an accurate number in that. And again, even carnivores, it may take a full 3 days to eliminate all of those plants and protein-based stuff in your gut to get an accurate one. But I don't measure any of this stuff very often because I feel great on doing what I'm doing. I had a low testosterone, I had a low vitamin D, my thyroid is fine. And I'm like, well, but I feel fine. Do these numbers mean you're sick, or is it just a guidepost for that? But a fasting glucose over 100 certainly maybe not good, but maybe it's over 80 if it's truly fasting. I did a 5-day fast in July. My fasting glucose was 52 and I felt fine. And so, I think you'll get a chance to play with it. That's the fun of this stuff. Get a continuous glucose monitor if you want, a ketone monitor, or get some blood tests. You can now, in certain states, most states, you can order your own blood test. You should be able to order every blood test you want and go and get it. Now, it may cost you out of pocket. I don't know the way you do that, but it's getting less expensive. It's getting more affordable for people to do this for sure.
Great. I just want to pop this comment from Ellie because I relate to this so much. I feel better. Haha. The kids have been eating bread and rice since their great grandma Kaden stayed with me for a week, getting back on track. Yeah, this is like the diet that my kids eat also when they go visit grandma.
Yeah, and think about it. Think about rice, corn, sorghum, wheat, and the majority of the grains around the globe that are grown. And they're damaging the soil and the land. They've eliminated the natural herbivores and the natural carnivores, and they were food created for the masses, the peasants, the prisoners, the slaves, and the soldiers, and feed them bread and beer, and they'll be fine. And rice, it's just toxic. And if you're gonna have, it's one of those things. White rice, well cooked. Add a ton of butter. I mean, 1-to-1 butter or cream, fat. That's where you should be. But if you have it from time to time in small amounts, again, it's okay. That's not the killer unless you have an anaphylactic reaction to it.
Right. Here is our next question.
Yeah.
Reflux sucks. Hormones seem messed up. Missing period for a couple months. 42 years old. Was very sick. Couldn't eat well. Lost a lot of weight. Still having gut issues. Carnivore, 3.5 months. How long do it take to get hormones regulate gut to heal?
Well, your hormones are not out of balance per se. The inflammation is damaging the receptors in the brain, the pituitary, and the adrenals, the thyroids, and the ovaries. But it may take 6 months to a year, and longer in some cases, depending on how much damage is done. But I will bet $1 billion you're healing in the next 3 months. Stick to it. Again, I think keep it very narrow. Look at Lisa Wiedemann. Look at Bella Moss, Steak and Butter Gang. There's so many. Laura Spath is great. Judy Cho is wonderful. So many people out there that are sharing these ways. But Occam's razor. Read Occam's razor, and the simple answer is the one. Basically, not so complicated. I am healthy and well, number one. Use the words, I am healthy and well. Look in the mirror and say those words. Every day, do your meditation and prayer. Do some light exercise. You don't have to do heavy duty exercise. I love hot tub. I love cold plunges. I love those things. And with all those things, the mind is the master. I'm healthy and well. I am healthy and well. Because, a lot of will I ever get healthy? What's going on with me? Why am I still hurting? What's going on? Or even saying my hormones are out of balance, or I have a food addiction. I never use those words because you're perfect and the universe is perfect in the way it works. All the things we've ever experienced, perfect. Nothing has ever been bad. It's all good. That's the part that I think it's something we need to think about more and more in this healing journey. And I think keto, carnivore, faith, and fasting are some things I really love. And we're learning from each other. Reflux sucks, it does for sure. And what is reflux caused by? Fermentation in the gut of the plants and the microbes, and the microbiome wants to kill you.
The microbiome wants to kill you. That's the first time I think I've heard you say that, but that's very interesting.
Well, it's really simple. Everyone says the microbiome is so important. Well,
right.
So would you take those microbes and put them in an open wound?
I don't think so.
No, you would not. Would you put
No.
them in your eyes? You know, you wouldn't do this. Would we inject those microbes in the embryo or the egg with some sperm and hopefully that microbiome is going to help it live? Again, we say a lot of things in science and medicine based on observations of what we think it is, not stepping back and going like, well, what if those microbes weren't there? Well, the problem is if those microbes weren't there, in what circumstances aren't they there? Is it because we shoved you full of antibiotics to kill them all, but we're still filling you full of a plant-based diet? And by the way, the plants come with the microbes. The microbes, like, they thrive on plants. Bacteria, yeast, and viruses thrive on plants. When you eat the plants, and you cannot necessarily kill them by boiling them or roasting them. They may not die, right? And the toxins get into our bodies, and basically we're filling our bowels with the bacteria, yeast, and viruses and their food, and they love you.
Okay, there you go. Arlene Backwoods, I'm carnivore 4.5 months, and I also became non-diabetic and getting and feeling stronger. That's awesome.
Yeah, keep at it. But you know, sometimes you have to look closely at your diet. What are you eating on carnivore? There may be something in there that just isn't working for you, and you know, clean it up.
There you go. Here we go. What my soccer 86? What exercise do you recommend for those with PCOS trying to conceive besides yoga and walking?
Feed him, flatter him, and make love to him. That's the exercise.
I love that.
I mean, it really is. So you know, what animal have you like noticed? Hey, they're exercising. What animal exercises? None. Do work. Be productive. That's what we need to do. Now, some weights and walking. You know, lift your body weight. Do some push-ups, pull-ups, sit-ups, get-ups, those sort of things. Just because you think you have to, but if you eat a proper human dietary bacon, eggs, butter, beef, as Kiltz like to say, and Ken Berry is the triple BE, bacon, butter, beef, and eggs. But I would say that, you know, yoga, tai chi, meditation, walking, that's all you need to do. Now, I happen to ride a bike just because I like it, but it's amazing how many people exercise and don't lose weight. Have you noticed that?
Oh yeah, I've been there. I've tried it.
It doesn't work. It doesn't work, right? Just eat the meat and you'll feel better than ever. I don't think Bella exercises. She sends Max over to Sean Baker's to get worked out in his garage.
That's hilarious.
Oh yeah.
Send the man over.
Yep. You go exercise.
Yeah, they're the one. You guys are supposed to be the protectors.
And again, for those who are, let's see, those are conceiving. Maybe we, instead of trying to conceive, those who are conceiving and building their family, it really is simplistic. I mean, you know, we're trying to time everything. Forget the timing. Just do it.
That's a good point. Like I said, I wanted to get pregnant. We tried. We got pregnant. We had a lot of sex. Sorry,
yes.
That's what happens. That's what you got to do to make the babies.
But people get angry, neurotic. You know, this is pelvic pain. All these things happen because of the diet that's damaging our brains, our reproductive systems, all these things, our ability even to get along and have intimacy. See, right. Yeah, it's not a slam bam. Thank you, ma'am. It's patience and love and touch and kindness and words and vision, all these things. And you know, when you're cooking in our traditional ancestral way, you know, it's you know, you're there, right? We're ancient tribal beings, and we're meant to be together and you know, going exercising. No, you went hunting, honey. I'm going hunting. Great. When you bring it back, I'll prepare it. We'll have the feast.
There you go. And then we'll make some babies.
Making babies. That's Kiltz makes babies. I always say Kiltz makes babies and Ovadia fixes hearts.
There you go. Hoosier, my friend Brett. I recently completed a 12-day water fast and felt good, but on day 11, I jogged a little and my blood sugar crashed, drank a little Gatorade, and I recovered fine. Why did that happen?
Well, did you measure your glucose levels? Or you just felt like your glucose went in the trash. Again, I, then you take these energy drinks, which contain drugs that make you feel good.
Mm-hmm.
Oh, I feel better. But is it hydration that made you feel better, or was it, and like after 12-day water fast and you go jogging, probably not the right way to do it. But again, now glucose is for glycosylation, not for energy. Remember, if you take a bunch of caffeine, you're going to get energy, right?
Well, you feel like it.
well, that's people. Oh, I'm energized, but is that energy, or
No.
is that a drug like cocaine, right? Or maybe those energy drinks made me feel better. It's people faint. I see this happen, and people faint. They say, "Oh, give them glucose." I say, no, just lift their legs up, get their fluid back to their head. They'll be fine. But remember, it's like Pavlov's dog, right? And it's like a placebo. So if I'm going to give you something sweet, you're going to feel better, correct?
Sure.
Right, because we've been led to believe that, or it does make you feel that way, because remember, why does sugar make you feel better when you eat it? Why does sex make you feel good?
Dopamine.
It's dopamine. So sex makes babies, and if you do it once and you're done, you may not have a baby. That's why it feels good, and you're supposed to have it more times than not. Okay? Sugar. In the ancient natural environment, sugar was rare, sweet, a fruit tree. How long was that fruit tree going to last? Not long. If you did not eat it while it was sweet, it was gone in a day. And your body wants you to eat that. Your brain wants you to eat that in order to get what?
The dopamine rush?
Fat.
Oh, to get fat. Okay.
Fat. Remember, if you don't eat it all down, you're missing the most important thing in the universe. Sugar's sweetness was rare in the ancient environment. When you found it, you better eat it in order to get fat. Or simply the plants want to take you down.
There you go. Especially the plastic ones.
Yes. Plastic, microplastics. Be careful. Drink your water out of glass. But one day they're going to say glass is bad too. So I don't know. You should probably sip it out of a natural spring. Next, we'll be making a natural spring in our backyard, and recommended to go drink out of that.
Yeah, exactly. Brad says I couldn't measure, I guess, his blood glucose because I almost passed out, but I didn't take but just a few ounces Gatorade. I felt fine. Blood sugar went back to the 80s, but I felt like it went very low.
Well, again, that's what we feel, but when you drank that stuff, it went up. But again, what I'm saying is that it's not the energy of the sugar. The sugars, think of plant sugars. It's a drug. Would you agree?
Yeah.
Is it different? Is it really different, the plant sugars, the way we consume them, and cocaine or caffeine or other stimulants? I don't know.
Yeah.
I just don't think when we say, oh, we need a glucose because it's our energy, it's a plant sugar. What other things come with that plant sugar? I don't know. What else is in Gatorade? I don't know. Kind of what's in Coca-Cola?
Hold on. I did a video about this. I have these two things sitting right next to me. One second.
Okay, go. Let's see it. We got time. I'm good.
So this is in Spanish because I live in Colombia, and they still use sugar in Coca-Cola, but in one bottle, there is 66 grams of sugar. And I think in the US, it's high fructose corn syrup. So that's what's in here, and a bunch of other crap, including words I can't read. But one of the elements in here is, I forgot what it was called, phosphorate. Anyways, it's the same stuff that they need dentists use to put in your teeth to like do cavities and stuff like that. But here, let me just do the Gatorade.
Well, think about it. Yeah. How many, what's in Gatorade?
So Gatorade, it says it has sugar, sodium, potassium. I mean, it has red flavor, red coloring. But this has dextrose, some sort of It's in Spanish, so I'm having a hard time reading
Well,
it. But
if it said it had high fructose corn syrup, if it said it had what is it, rapeseed oil,
okay.
if it said it had sunflower seed oil or peanut oil, is it only fat in that oil?
No, I don't
It's
think
not.
so.
What else is in that oil?
Lots of bad stuff because it's super processed.
Right, but it's from a plant. Do those plant oils contain any other substances? Does it contain any plant chemicals that are soluble in the oil, the fat? Yes.
I have no idea. Okay.
Well, likely yes. I mean, what's pure oil, right? It's not pure oil. So imagine when you get a Coke or a Gatorade and they say it's made with this, this, and this. Does that mean there's no other substances from the sources of those foods, the food stuff, right?
Yeah. I
Does
don't
it make
know.
sense?
Yeah, I think so.
And so what I'm partly saying here is that okay, glucose, fructose.
Yeah.
Okay, is it a pure substance or are there other things in that? Again, just like getting back to the Coca-Cola, it's a secret formula, right?
Right.
You and I have no idea what's in it.
Right.
Gatorade, is it proprietary? It's secret.
Yeah, exactly. Also owned by Coca-Cola, just so everyone knows.
So again, sometimes after a 11-day fast and exercising, maybe the things to do is rest. Just lay down, right? Let your body rejuvenate.
Right.
And remember, we make water out of the breakdown and metabolism of fat into ATP.
Okay.
Less water is also better.
Oh, that's good. Good.
We drink too much water, so.
Okay.
All right. You name it when you're done. Got a couple more minutes.
Okay, good. We'll take this last one. My daughter, 16 years old, still gets headaches weekly after 3.5 years as 100% carnivore, more salt or water or ?
Well, when we say 100% carnivore, I don't know what that means when it comes to fat at all. And I think fat is one of the most important things to consume. But my bet is we should be eating more raw fat from an animal or less cooked fat. Remember, when you render it and cook it, you may be damaging the minerals, vitamins, amino acids, glycans. So look up the word glycan. They're sugars that are in the cells of our body. And there are many of them, not just glucose, by the way. And so when we cook our food, we damage the minerals, vitamins, and the other macronutrients, amino acids, sugars, and fatty acids. So if you're eating a high protein based or well-cooked meat, even though you're a carnivore, you may be not getting the right proportion. Eat more fat, do more fasting, and then look and make sure, coffee or other drinks and things like that aren't being consumed of any significance or frequency. But even headaches from time to time may be related to the environment, plastic plants, the things we drink or eat out of, the things that are circulated in our homes and our business and our cars, from the air conditioning areas that may be part of what's getting into our body, just like the bacteria, yeast, and viruses in our exposure with others that can cause some inflammation in certain organs, and especially the brain, which could be a culprit in that.
Good to know. Really good to know.
And so again, eggs and lots of butter. Again, butter can be antigenic. Eggs can be antigenic, and again, the why part. I mean, I get rare headaches these days, but I used to have them all the time. It's pretty rare, but these are, again, we're exposed. Things that get into our body get in through our skin, get in through our GI tract, get in through our respiratory tract, get into our bodies and can also stimulate some of these factors that we're not thinking about.
There you go. Thank you. Okay, so I think we will end soon, but what would you say to wrap up this live stream?
Well, Occam's razor says it's simple. If you're not feeling well and feeling at your tip top best, or you're looking around and seeing people like, wow, I want to feel and look like that. To me, carnivore is the answer. It is the top of the line. Keto is for the masses and carnivore is for the masters. And we are all born masters. And you have to practice the master's way. And this is why I think we're all blogging, we're all writing, we're all reading, we're all listening to each other. We're trying to, like, what is it you do and you do and you do? I mean, all these people that are just amazing. And the other point I just want to say, let me get back to carnivore boss, is that even on carnivore, it doesn't mean you're not going to get the diseases that we suffer from as humanity. So we're all going to die from something, but in essence, have faith first in God and look in the mirror and there he it is. Number two, eat the fatty meat, and just one meal a day is to me is the best thing to do. And go be creative in life. This idea that somehow, you're supposed to, exercise and somehow be and do something. You're the only one that determines that. Be you.
Awesome. I love that. Thank you so much. And thank you so much for joining me today.
I am so grateful, Aaliyah, that you've invited me. I've had so much fun, and I've met so many great, amazing people. And we're all, again, we're sharing and learning in this new social media medical way for healing so many people. So again, God bless and thank you. And thanks to everyone.
Thank you too. All right. That's it. I'm hitting end of stream. Thank you so much.